Hey there, Dimitri from Total Physical Therapy, total-pt.com. Today we are actually going to talk about something called neural tension. What that means is tension on a peripheral nerve, whether it be sciatic nerve or the nerves that go down the arm. We're going to talk about the arm today. A lot of times when folks are doing any type of mobility work and trying to stretch out, sometimes when they're moving their arms back or trying to stretch out their pecs or biceps or arms, they'll feel almost like a nervy pain where it doesn't feel like a muscle stretch, but it feels like a little tingly in the hand. Most of the time what that is what's called neural tension. Now what that really means is this: when you are trying to stretch out tissues such as the hamstring, you can feel the hamstring's tight, you stretch it out, you feel that muscle stretch feeling. And what that simply is you feel that muscle stretching. But just like muscles stretch and just like skin and other tissues stretch, t-shirts have tension, your nerves actually have mobility and flexibility as well. So if I take my arm and I bring it up in the air, my t-shirt's stretching, my skin stretches, my muscles stretch to allow my arm to move. Well, inside that arm are arteries and veins and other types of tissues as well as nerves. So I need to have adequate length, not only in all the things that you're familiar with, but also the nerves that go from the neck into the arm. So I need to have that mobility, otherwise that is going to restrict me, the nerve aspect, and I'm going to get that tingling in my hand. Sometimes you get the funny bone feeling, or in this side of the hand, or sometimes it's in the palm. And what that is neural tension, and we can actually access that and stretch that out independently. Obviously a lot of folks who have herniated discs or bulging discs in their neck, or neck pain or shoulder pain, can get this as well, because when the discs bulge, they can bulge and press on the nerve root as it goes down and out into the arm. So there's a bundle of nerves that comes out of the neck called the brachial plexus, and it's a bunch of nerves from here to there, and they come out, they go through the shoulder and down in the arm. So the trick is to really put tension on that brachial plexus to create a tug effect. So the concept is really simple. In order to get those nerves to stretch, you do a bunch of things. 1, you depress the shoulder. 2, straighten out the elbow. 3, open up the fingers and open the palm. 4, cock the wrist back. And at this point, most of you, if you stack those movements, will already feel that tug or that nervy tension in the arm. And then after that, you pull out and behind you. And you can also turn away to, again, gain even more tension. So in this position, I feel a pretty good, almost like a vibratory zinging feeling from like my elbow down. And if I bring my shoulder up, all of that comes off. Why? Because I took that brachial plexus and I shortened it and took all the tension off. So again, the motions are stacked, and you do not hold them once you get to that end range. So again, the motions are shoulder depression, straighten, lock out the elbow and extension, open the palm, cock the wrist back, and then turn, and then pull your arm out and away. And again, you could also, as an option, turn away from the side that you're trying to stretch. And what I tell my clients is, you want to do 10 of those, pressure on, pressure off. So 10 repetitions, and you want to do it every couple hours or spaced further apart. You can do it more aggressively, but you don't want to do that on your own too much. And the concept here is to gently and gradually stretch out those nerves so we can have some slack in the length. So as you are doing whatever it is that you're doing, whether you're swinging a baseball bat or a tennis racket or swimming or doing whatever it is you want to do, that nerve has to have that range of motion to accomplish that task so it's not compromised. All right? Try it out. We'll see you next time.